If you or someone you love has never been diagnosed with cancer, it may seem like something that could never happen to you. But cancer doesn't discriminate or play the odds. It will take anyone, anywhere, and at any time. And if you're a woman, breast cancer may be your deadliest threat. However, breast cancer can be detected early on, and every day, scientists are feverishly working to find a cure. In this video, you'll learn what breast cancer is, the different stages of breast cancer, the variety of treatments available, risk factors for the disease, and finally, what you can do for early prevention. Breast cancer is a type of cancer where cells in the breast tissue divide and grow without the usual controls on cell death and cell division. The most common type of breast cancer grows in the lining of the ducts, or thin tubes connecting the nipple to the other parts of the breast. This is called ductal carcinoma. Another common type, lobular carcinoma, begins in the lobules, or small sections of the breast which contain the bulbs for producing milk. No matter where it begins, when the disease spreads outside of the breast, the cancer cells are often found in the lymph nodes under the arm, or axillary lymph nodes. Once the cancer has reached these nodes, it may mean that the cancer cells have spread to the other parts of the body, including other lymph nodes and other organs, such as the lungs, bones, and liver, through the bloodstream. Not all breast cancer can be put in one category. There are many stages of cancer, all with different methods of prevention and treatments. Stage 0 breast cancer is called non-invasive carcinoma, or carcinoma in situ. This early stage of the cancer can be considered a precancerous condition. In stage 0, there is no evidence of cancer cells having broken through the part of the breast it started in, or of getting through to or invading neighboring normal tissue. Some of these cancer cells, if left untreated or not removed from the breast, can become invasive cells. In stage 1 breast cancer, the cells have turned cancerous but have not spread beyond the breast. Stage 2 breast cancer is an invasive cancer where the cancer cells or tumor have done one of the following. The tumor is less than an inch across and has spread to the lymph nodes under the arm. The tumor is between 1 and 2 inches across, with or without spreading to the lymph nodes under the arm. Or the tumor is larger than 2 inches but has not spread to the lymph nodes under the arm. Still at an early stage of the disease, breast-sparing surgery or lumpectomy may be necessary. For some, a mastectomy or full removal of the breast may be in order. In addition, radiation therapy, chemotherapy, and/or hormonal therapy may also be administered to try to destroy any remaining cancer cells and to prevent the cancer from spreading. Stage 3 breast cancer, also called locally advanced cancer, is when the tumor in the breast is more than 2 inches across and the cancer is extensive in the underarm lymph nodes. It could also mean that the tumor has spread to the other lymph nodes or tissues near the breast. Patients with stage 3 breast cancer require local treatment to remove the cancer, such as surgery, as well as radiation and systematic treatments to stop the cancer from spreading, which may include chemotherapy or hormonal therapy. Breast cancer's most devastating phase is stage 4. This occurs when the cancer has spread from the breast to other parts of the body. This is called metastatic breast cancer. Women with stage 4 breast cancer often receive chemotherapy and hormonal therapy along with surgery and radiation. Men can experience breast cancer as well. However, recently, men's breast cancer statistics are much less troubling than women's. According to the Susan G. Komen website, in 2007, an estimated 2,030 men in the United States will be diagnosed with new cases of invasive breast cancer, compared to 178,480 women. And 450 men will die of breast cancer, compared to 40,460 women. While so many women contract the disease every day, scientists and doctors alike are still unsure what exactly causes cancer.
Breast cancer, unlike some of the other cancers, is not something that most women can control. We know that lung cancer is something that can be controlled in the majority of the cases. Breast cancer, that's not true. It's important for women to be aware of what might signal the identification of breast cancer, to treat it early, to have a better outcome. But in regards to the causation, there's not a whole lot of things that we can do that's going to change that.
According to the National Cancer Institute, research has shown that the following conditions place a woman at an increased risk for breast cancer. Personal history. Women who have had breast cancer face an increased risk of having it come back again. Genetic alterations. Changes in certain genes, like breast cancer 1 and breast cancer 2, make women more susceptible to the disease. Family history. If a woman's mother, sister, daughter, or 2 or more other close relatives, such as cousins, have a history of breast cancer, especially at a young age, she is at a higher risk of getting breast cancer. Certain breast changes. Having been diagnosed of atypical lipoplasm or lobular carcinoma in situ, LCIS, or having had 2 or more breast biopsies for other benign conditions also increases your risk. Other factors that put women at an increased risk for breast cancer are: if a woman age 45 and older has a mammogram that shows at least 75% dense tissue, if a woman's breasts were exposed to radiation during their childhood, especially if she was treated for Hodgkin's disease with radiation, if a woman had her first child after the age of 30, if a woman started menstruating at an early age, as in before the age of 12, if a woman experienced menopause late, as in after age 55, and if a woman took hormone replacement therapy or birth control pills for long periods of time. In most cases, doctors cannot pinpoint why or when a woman develops breast cancer. What makes this disease so unpredictable is that studies show the majority of women who develop breast cancer have none of the risk factors listed above, besides growing older. Also, most women with 1 or more of the known risk factors never get breast cancer. Scientists believe that breast cancer is caused by a combination of both known and unknown factors. However, that doesn't mean the situation is hopeless or that there's nothing women can do to protect themselves and maintain healthy lifestyles. It's critical to know that survival rates increase dramatically when breast cancer is detected and treated early. Self-breast exams every month and mammograms every year after age 40 will help with early detection. In addition to regular self- and doctor-administered checkups, there are symptoms women should watch for, which indicate they have signs of breast cancer and should see a doctor immediately. For instance, a lump, hard knot or thickening, swelling, warmth, redness, or darkening, change in breast size or shape, dimpling or puckering of the skin, itchy, scaly, sore, or rash on the nipple, pulling in of your nipple or other parts of the breast, nipple discharge that starts suddenly, or new pain in one spot.
Awareness is probably the best thing that you can do. Making sure that your friends and colleagues do get their mammograms, that they do follow through on something that they feel is abnormal, that they do be aware. A lot of women may find something but don't want to know what it is. They're afraid to identify what that means. That's only going to lead to worsening of the problem. So you want to try and pursue something and be aware that it can make a difference. And just because it doesn't hurt doesn't mean that it's not bad. If it's different for you, you need to address that.
While breast cancer is the leading cause of death for women, even higher than AIDS, it is not unstoppable.
Expect to be cured. That's the goal. Find it early, be aware, expect to be cured.
Organizations like the Susan G. Komen Foundation, the Cancer Treatment Centers of America, and many more are fighting every day to save lives and end breast cancer forever by empowering people, ensuring quality care for all, and energizing science to find the cures. The science is here. Now, while scientists are working diligently to find a cure, it's up to you to stay healthy and support the work that one day will save women and men from this life-threatening disease.